Breast cancer is a malignant tumor that starts in the cell of the breast. A malignant tumor is a group of cancer cells that can grow into or invade surrounding tissues or spread to distant areas of the body. The disease occurs almost entirely in women, but men can get it too. To understand breast cancer, it helps to have some basic knowledge about the normal structure of the breast. The female breast is made up of mainly of lobes, milk-producing glands. Ducts are tiny tubes that carry the milk from the lobes to the nipples. And stroma is the fatty tissue and conductive tissue surrounding the ducts and lobes, blood vessels, and lymphatic vessels. Most breast cancer begin in the cell that lines the duct. Some begins in the cell that lines the lobes, while a small number starts in other tissues. The lymphatic system is important to understand because it is one way breast cancer is spread. The system has several parts. Lymph nodes are small bead-shaped collection of immune system cells that are important in fighting infections that are connected by lymphatic vessels. Lymphatic vessels are like small veins, except they carry a clear fluid called lymph instead of blood away from the breast. Lymph contains tissue fluid and waste products as well as immune system cells. Breast cancer cells can enter lymphatic vessels and begin to grow in lymph nodes. And how can cancer develop? Cancer can occur as a result of mutation or abnormal changes or in the genes responsible for regulating the growth of cells and keeping them healthy. A tumor can be benign but not dangerous, or malignant has the potential to be dangerous. Benign tumors are not considered cancerous. Their cells are close to normal in appearance. They grow slowly and they do not invade nearby tissues or spread to other parts of the body. Malignant tumors are cancerous. Left unchecked, malignant cells eventually can spread beyond the original tumor to other parts of the body. Breast cancer can develop. Cancer cells can invade nearby healthy breast tissue and make their way into the under lymph nodes. Small organs that filter out foreign substances in the body. Usually breast cancer either begins in the cell of the lobes, which are the milk-producing glands, or the ducts, the passages that drain milk from the lobes to the nipples. Less commonly, breast cancer can begin in the stromal tissues, which includes the fatty and fibrous conductive tissues of the breast. If cancer cell isn't in the lymph nodes, they have other ways to enter the body. The common kinds of breast cancers are ductal carcinoma, is the most common kind, and it begins in the line of the milk ducts in the breast, also called the lining of the breast ducts. Ductal carcinoma in situ, DCIS, the abnormal cancer cells are only in the lining of the milk ducts and have not spread to other tissues in the breast. Invasion ductal carcinoma, the abnormal cancer cells break through the ducts and spread into the other parts of the breast tissue. Invasion cancer cells can also spread to other parts of the body. Lobular carcinoma is the kind of breast cancer the cancer cell begins in the lobes or lobules of the breast. Lobules are the glands that make milk. Lobular carcinoma in situ, LCIS, The cancer cells are found only in the breast lobules. Lobular carcinoma in situ, or LCIS, does not spread to other tissues. Invasive lobular carcinoma, cancer cells spread from the lobules in the breast tissues that are close by. These invasive cancer cells can also spread to other parts of the body. And some of the symptoms of breast cancers are new lumps in the breast or underarm, which is the armpit, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipples or pain in the nipple area, nipple discharge other than breast milk, including blood, any changes in size or shape of the breast, pain in any area of the breast. Keep in mind that some of these warning signs can happen with other conditions other than cancer. Breast biopsies is the only sure way to determine whether a lump is cancerous is to do a biopsy. This involves taking a tissue sample for further examination in the lab. Sometimes with a small needle, sometimes surgery is done to take part of or the entire lump for testing. The result will show whether the lump is cancer, and if so, what type. There are several forms of breast cancer, and treatments are carefully matched to the type of cancer. And how are breast cancer diagnosed? It can be diagnosed with an ultrasound. It's a machine uses sound waves to make detailed pictures called sonograms of areas inside the breast. A mammogram, if you have a problem in your breast, such as a lump, or if an area of the breast looks abnormal, on a screening mammogram, doctors may have to get a diagnostic mammogram. This is a more detailed X-ray of the breast. And an MRI, a kind of body scan that uses a magnetic link to a computer. The MRI scan will make detailed pictures of areas inside the breast. In a biopsy, this is a test that removes tissue or fluid from the breast to be looked at under a microscope and do more testing. There are different kinds of biopsies. For example, fine needle aspiration, cord biopsy, or an open biopsy. And how are breast cancer treated? Surgery is an operation where doctors cut out the cancer tissue. Chemotherapy, using special medicine to shrink and kill the cancer cell. The drugs can be pills you take or medicine even in your veins, or sometimes both. Hormone therapy blocks cancer cells from getting the hormones they need to grow. Biological therapy works with your body's immune system to help it fight cancer or to control side effects from other cancer treatment. Side effects are how your body reacts to a drug or treatment. Radiation therapy is using high energy rays similar to X-ray to kill cancer cells. Doctors from different specialties often work together to treat breast cancer. Surgeons are doctors who perform operations. Medical oncologists are doctors who treat cancer with medicine. Radiation oncologists are doctors who treat cancer with radiation. Breast cancer surgery. There are many types of breast cancer surgery, from taking out the area around the lump, which is a lumpectomy, or breast conservation surgery, to removing the entire breast, a mastectomy. It's best to discuss the pros and cons of each of these procedures with your doctors before deciding what is right for you. And side effects of treatment can be loss of appetite, nausea and vomiting, weakness and fatigue, mouth soreness, hair loss, weight gain, premature menopause, lowered resistance to infection, bleeding, and diarrhea. So the bottom line is it's important to know the signs of breast cancer, even if you think that a lump isn't important. It's better to have it checked out. The earlier the diagnosis, the better the survival rate that you'll have.